My name is Dr. Briana Rueda. I am board certified in family medicine, and I'm also certified by the Institute for Functional Medicine in functional medicine. And I have additional training in hormone replacement therapy from the American Academy of Anti-Aging Medicine. So, how I got into medicine, I actually always wanted to work in healthcare. I didn't really know what the field at the time, so I was really into lifestyle medicine when I was younger and got a bachelor's in nutrition. After getting my bachelor's, I went to physician assistant school and got my master's in PA and worked in various fields in medicine as a PA. And while I was practicing as a PA, I had several of my own ailments that I was dealing with. And like many people, I was going through the system from specialist to specialist and had multiple blood tests and sleep studies and MRIs and various medications. And no matter what I did, I never felt well. So I specifically remember looking online and finding an integrative medicine physician in the area that I was living and decided to go ahead and see this provider. And so glad I did. He diagnosed me with Hashimoto's hypothyroidism, small intestinal bacterial overgrowth, and I got the treatment I needed. And for the first time, I finally started to feel better. And it was during this experience that I said, you know what, this is my calling. This is the type of medicine that I want to practice and provide for my patients. And during the same time, I decided this is also when I need to go back and get as much training as I possibly can so I can be the best physician that I can be. So I went back to medical school and I graduated with honors from the Chicago College of Osteopathic Medicine. And then I pursued my family medicine residency in Utah and also served as chief resident when I was there. While in residency, I was really working on my integrative medicine skills because I knew when I was all done with residency, I would want to do integrative medicine. So at the same time, I completed the Institute for Functional Medicine's certification program while I was going through residency. Also during residency, I started to develop a passion for hormone balancing. And where that stems from is actually a pretty personal journey. So, like many people going through life, completing additional training, additional schooling, doctorate programs, I was doing everything I could to prevent pregnancy, right? So, I was on a Mirena IUD at the time. And when I was all done with residency, we decided, okay, I'm in my late 30s. This is now or never if we're gonna have kids. So let's try. Had the Mirena IUD taken out, nothing happened. So months later, I went to see a reproductive endocrinologist, and he was asking me a bunch of questions about my history, and it kind of clicked all of a sudden. I said, you know what? I've never had just a spontaneous natural menstrual cycle. I never got a period when I was a teenager. And so back then, my provider had put me on birth control pills to make me get a period. And after being on pills for several years, I got a Mirena IUD, and then I got another Mirena IUD just to kind of get me through all of my schooling. And then all said and done, I thought, you know, I've never had a natural cycle. So then I had the Cadillac workup, genetic testing and everything came back normal other than I had postmenopausal levels of hormones. I thought, oh, wow, I wish someone would have discovered this a while ago. So then I was put on natural bioidentical hormone replacement therapy because I should have estrogen in my body in my late 30s. And I noticed a huge improvement in energy, huge improvement in sleep on progesterone. I felt so much better. And that really solidified my desire to become very good at hormone balancing and provide this kind of treatment for other people. And that's when I went and did additional training with the A4M, the American Academy of Anti-Aging Medicine, on hormone balancing. So fast forward to being in practice now and deciding to have a family, feeling great on my hormone replacement therapy, but I have to do assisted reproductive techniques in order to get pregnant. So we decided for us the best route was IVF. So then I went through 3 cycles of IVF, and being on super physiologic levels of hormones, feeling, bloated and fatigued and sluggish. So I tell women, I get it. I know what it's like. I've been there. I know what it feels like to have no hormones, and I know what it feels like to be overdosed on hormones. And both of them feel crummy. So I totally get it. Thankfully, we have a beautiful son now. I could not be happier. These experiences really solidified my desire to offer cutting edge hormone replacement therapy for my patients. And this is what led me down this path to leave conventional medicine and join private practice so I can really build on my integrative medicine, anti-aging, longevity medicine practice and provide these services for the people in my community. One question I do get a lot from people is, what is anti-aging medicine? Great question. It dovetails with hormone replacement therapy because anti-aging medicine, which I truly feel is the new wave of medicine, this is the way the future is going, is using a combination of lifestyle medicine with pharmacotherapy, with medications, supplements, botanicals, to not only treat disease, but now prolong health span, prolong number of healthy years that people are living. It's attacking wellness from multiple directions so that we can feel our optimal, feel our best, feel the best we can be for as many years as possible. That's what anti-aging medicine is. And this is the wave of the future. And I'm so excited and so blessed to be able to provide this for my patients.